Oh, Mrs. Bennett, I see that you brought the breathing exercises with you. If you need help with them, I can help you after we get done.
Welcome, everyone. Thank you for joining us today. We're here to discuss the discharge status of Mrs. Bennett for the best timing on her recovery and getting her back home. Welcome, Mrs. Bennett. Good to see you again. Mrs. Bennett is 84 years old, and we admitted her to our facility on February 20th. Her current status is post-bowel resection, and she's due for her next consult on March 2nd. Mrs. Bennett, that is the date you were told, correct?
Yes.
Anna.
Thanks, Karen. Here's some other information we've been gathering and measuring since we've gotten to know Mrs. Bennett. In addition to her bowel resection, she also has a history of hypertension, depression, non-insulin dependent diabetes. Mrs. Bennett also has bipolar disorder, chronic back pain, and low vision. Because of this, she's taking 7 medications. She's taken Percocet for her chronic back pain and metformin for her diabetes. Additionally, she was hospitalized for 5 days. Now, according to my notes, her risk for hospital readmission is 10, indicating a rising risk for hospital readmission.
Before we get too far into this discussion, I just have to say we have concerns about Mom going home. We want her to come home, we want her with us, but she needs to be able to do things on her own.
Thank you, Terry. We all thank you, and we certainly appreciate your input. And we want to address all your concerns, major or minor, as they occur. But let's take a look at all the information, and at the end, we can address any issues you may have. Sound good? Anna, Ms. Bennett is a complex patient, as her children have more than adequately expressed, and I'm concerned as well. So we need to review her finger sticks to ensure that her blood glucose values are under control, and also we need to get a BMP, basic metabolic panel, on her as well.
That sounds good. I'll have the pharmacist do review her medications regimen and look for any inconsistencies.
Thank you, Anna. Here's some other information for us to consider. Mrs. Bennett is actively participating in physical and occupational therapy. Her target MBI score is an 82, and she's currently at a 73. She's transferring with supervision and ambulating 150 feet with a rolling walker. She's cognitively intact and follows directions well. She's independent with her bed mobility. Her bathing and dressing is a contact guard setup assist. There have been a couple of barriers to her progression with therapy, such as the loose stools and the nausea has been persistent. At this time, we're recommending that she be put on a restorative nursing program, and which we will transition her to and educate the nurses on. They will be ambulating her at least once a day with a rolling walker and with supervision level. How does that sound?
I really would like to go home, where my belongings are, and my friends are nearby. They said they'd help.
I know, Mom. We're doing the best we can.
Ms. Bennett, we are working on this for you and to get you home with the best possible timing. And I'm sure your friends are more than eager to have you back among them. As we work towards that and look into the best timing, our primary concern is your safety and ability to heal quickly. So we need to consider all factors involved. I really am glad, though, that you're here to share your feelings with us so that we can get a better understanding as to what you're going through in present time. Because this decision is important, we want to take our time, and we really need to consider everything. Now, Anna, be sure to document for the nursing staff her ability to ambulate at least once a day using her assistive device on the nursing unit with nursing supervision. Andy, if you could, please note that her endurance is limited by metastatic cancer. And as far as the nausea goes, we have Phenergan ordered as needed for Mrs. Bennett. And I see for the loose stools there is loperamide as well.
Okay, thanks. We know that her children live out of town. But even so, they are accessible by phone, very accessible in case we need them for anything. And her code status is DNR, do not resuscitate, due to her cancer. But I think that it's great that you came to that choice on your own when you first arrived.
Okay. Thanks, Lana. Now, it's important that we have as many options mapped out as we can. Now, just for the group to note, she will be discontinued from therapy not this week, but next week. But she should probably remain skilled at the center because of her blood sugar fluctuations and poor oral intake.
Please, I don't want to stay at this facility.
I know, Mom. We're doing our best.
Mrs. Bennett, we do appreciate that staying here for you is not your first choice. And believe it or not, it's not our first choice either. But we have to be sure that your well-being and your safety have all been taken care of before we can release you.
So, do we need to talk about a date for her transition from the center?
Certainly. Now, because she also has limited oral intake, we're going to need to review that next week also. If it's above 75%, we'll have to see if she still meets the skill criteria or not. We also must keep her wishes at the forefront in all of our recommendations. Agreed?
Absolutely. In terms of coverage, Mrs. Bennett believes she has 80 Medicare days remaining. She has her private insurance as her secondary, but after those days are covered, she'll have to pay out of pocket. We'll weigh the information discussed today and make a determination within a few days. Thanks all for joining us.
Okay, thank you.